that was spelled right. Anyway, in just a few hours, the GOP will be unveiling its comprehensive health care plan. Here now, with the first on CNBC interview, is Representative Eric Cantor, Minority Whip. Good morning, Congressman. How are you? Good to see you. What should we do here? What's the GOP's idea, and how does it differ from what's likely to come through?
Well, listen, Joe, the revelation the other day when the Congressional Budget Office came out and said that we have now a $1 trillion-plus cost on the plan coming out from the other side, I think it just speaks to where we start on the Republican side, and that is we do not feel it is necessary for us to have a bigger government plan in place to try and address the issues surrounding the health care reform needs in this country. I think next what you will see in our plan is we really will provide a way for people to keep what they've got if they like it. And that means we've got to provide the flexibility for employer-based plans to stay in the game so that we can have the innovation that has proven to bring down cost. And ultimately, what we want to do with the uninsured is we want to allow the uninsured the ability to access basic coverage in an affordable way, which means that you will see increased networks and abilities for people to find a health plan that best suits their needs and to allow for as much choice as possible. All right.
Can that be done with a public plan?
Well, the problem with a public plan, again, you see the numbers out of the Congressional Budget Office. The Democrats' plans, the estimates are it'll cost over $1 trillion, and we're not even going to insure more than a third of the uninsured right now. I think the figures have said that that's about over $6,000 a year per individual when you have the average cost significantly less, around $4,800 per individual in the private sector. So right away that proves you can't do it cheaper by the government, and I think most people would agree you can't do it better, and you won't have the quality care. And so what we've got right now in Medicare, where most people and the beneficiaries like what they have, but at the final analysis, what Medicare really represents is a government-sponsored price-fixing situation that has caused enormous amounts of inefficient use of capital and overutilization of the system. So we don't want to expand that. What we want to do is try and fix that piece of it. And at the end of the day, you want a level playing field for competition. You can't do that if you provide for a government plan to compete with the private sector.
How are you going to pay for it, and how will you wring costs out of what is already a bloated system?
Well, let me start by saying how do we wring costs out of a bloated system? You know, the bloated system is, first of all, premised on this price fixing. The very best doctor in the country gets paid the same as the worst doctor. Same goes for hospitals. Then you've got bureaucrats here in Washington assigning value to certain types of treatments and provision of health services, which have very little to do with real market value out there. We've got to get back to a much closer view in terms of what the patients see as far as information is concerned, create much more of a competitive free market. And so that's number one. That's how we start to bring down costs. We've seen that work in Medicare Part D. We've seen competition actually take place and allow for the players in the market to compete for beneficiaries' business. That's what we want to do. Now, at the end of the day, how we pay for health care will be the very difficult question. What the Democrats have proposed is, and the President has now endorsed something that he opposed in the campaign, which was to tax health care benefits. That's extremely unpopular, especially given the economic times that most American families find themselves in. So we've got a lot to do in terms of finding out how to pay for this. But first off, we can't go the route of the Democrat plan that was unveiled earlier this week when you're talking about $1 trillion and not insuring but one-third of the uninsured.
So you don't want to tax benefits on some, I mean, a lot of people are fairly well off. And this is like a Cadillac plan that they've got, and none of the benefits are taxed. You don't want to do that either. You know who the other big group that won't let that happen, and you got on your side, the unions. So you're in bed with the unions here, Eric? Is that?
Well, Joe, what I think ultimately all of us would like to see is a health care system that was much more focused on the patient, and that means allowing patients a lot more ability and give them a lot more tools and empower them to go purchase their own coverage. As you know, right now in the system, 70% of the people in this country get their health care through employers. By and large, most of them are through ERISA plans. And so what we've got now are third-party payors that ultimately distract from development of a much more competitive market. So if we're going to move in that direction, we've got to go and give individuals, sole proprietors, small business people, the same benefits that we give large employers right now so that they can go out and purchase their own health care plan, which involves giving them some kind of tax incentive to do so.
Congressman, thank you. It's the beginning of the end of the beginning, no, beginning of the beginning, I think. Thank you.
Thank you.
Okay, see you.